My name is Simrat Deol, and I'm the sister of Noor Deol. Noor has acute lymphoblastic leukemia, otherwise known as ALL, and is in the need of a bone marrow transplant. I have here with me today Dr. Mark Minden and colleagues who are going to explain what ALL is and how a bone marrow transplant will help Noor. I will be asking the doctors a series of questions in order to learn more about ALL. So firstly, Dr. Minden, what is leukemia?
Leukemia is a disease of the bone marrow in which there's a overproduction of cells. In the case of an acute leukemia, those cells are immature cells, and that is that they haven't differentiated as they normally should, and they have a very immature phenotype. ALL, or acute lymphoblastic leukemia, can be seen at all ages, really.
Mm-hmm. So can you explain what the general treatment process for a case such as Noor's will be? And then Noor specifically also has a Philadelphia chromosome positive. So what does that specifically mean for him?
The Philadelphia chromosome is a translocation of two different chromosomes 9 and 22, that forms a new protein that drives the growth of cells. And in very young people, the Philadelphia chromosome is found in about 5% of cases, but as we get older, it can be in up to 20 or 25% of adult ALLs.
Okay.
The Philadelphia chromosome, or BCR-ABL, the protein it makes, can be targeted with specific drugs like imatinib or dasatinib.
Oh, okay. And then, so what would be the general treatment process for such a case?
For Philadelphia positive ALL, we use chemotherapy plus, as I said, either imatinib or dasatinib to increase the amount of killing. So prior to having these two drugs, the response rate to chemotherapy was on the order of 60-70%. But now with the targeted agents plus chemotherapy, 95% of patients are going into remission.
Aside from chemotherapy, there's also the possibility of having a bone marrow transplant. So can you explain the processes for such a treatment?
Well, patients who have the Philadelphia chromosome, or BCR-ABL, even though the imatinib or dasatinib is helping, they have a high chance of the disease coming back. And so to reduce that chance of disease recurrence, we do a bone marrow transplant. And with the bone marrow transplant, you give very high doses of chemotherapy that really wipes out all the bone marrow, all the normal cells and all the leukemic cells that are in the bone marrow. And without that, a person would die. So to get a person through the procedure of transplant, we take cells from somebody else, and after all the chemotherapy, we give them the normal cells of that other person, and that allows them to survive the treatment and actually recover the counts within about 3 weeks or so.
So what are the chances that somebody will match in your intermediate family, and who has the highest chance?
Each individual sibling is a match about 1 in 4. Okay, so as you have a bigger and bigger family, the chance of having a donor gets higher and higher. But as our family sizes shrink, so we only have one brother or one sister, then there's only a 25% chance you're going to have a match within your family if you only have one sibling.
And what about the parents?
The parent is a half match, so it's very, very rare that a parent will be a full match. The parent's a half match, and we are doing what we call haplotransplants, but we right now are still preferring either to do a sibling or a 10 out of 10 unrelated transplant over a haplo.
So as you've mentioned, finding a match in the family is quite low. So what about the general population?
The chance of finding somebody out there in the bone marrow transplant world book, so there's a network of centers that collect potential donors, and they do the HLA typing. That's how we identify who's going to be a match. And the people are recruited from different parts of the world, and so you have a database in Canada, one in the United States. Europe has their own database, but they're all linked together. The representation of different communities within this collection varies. So Western Europe is very well represented. So if you're of Western European descent, there's probably a 70% chance of finding a donor. But other communities have not been recruited efficiently into these databases. And so the chance of finding a donor gets lower depending on the number of people from your community that are in that database. So the Southeast Asian community has a lower representation than Western Europe. And so the fact that if you're of that ethnicity, the chance of finding a donor is lower than other ethnic groups.
So our target community for the One Match event is males aged 17 to 35 from the South Asian community. However, everyone is of course welcome to this event, but can you explain why males and this age range is very important?
The reason for young males up to age 35 is that they're going to be healthy, and we want them to be in the registry for a long time. Okay, so if somebody is recruited in their 60s, they're going to be unhealthy and they're not going to be around for a long time. But somebody who's 35, they're going to be in the registry for 20, 30 years and available to a lot of people. So that's why we're collecting or targeting the 17 to 35 group.
So what is the procedure of the bone marrow transplant?
The procedure for being a transplant donor is, first of all, to give blood that goes into the database to identify what your HLA is. And that's just a blood test. Or it can be a swab from inside the mouth, so either blood or a swab from inside the mouth. And your data sits there. If it's found that you're a potential donor, then you will be approached and asked for another sample to confirm the first sample, so another blood test. And if you are proven to be a match, then you will be asked if you want to go ahead with being a donor. And at that time, you would have a physical examination to make sure you're okay, that you're healthy, you can be a suitable donor. And then if you are going to be a donor, the cells can be collected in two ways. One is by having bone marrow taken from your hip bones, but now more commonly people are given a growth factor called GCSF or Neupogen that causes the white cell count to go very high, and we collect those cells in a machine over a few hours on one day. So the process of being a donor involves getting 4 injections of a needle to get your white count up, and then a couple of hours on a machine. This does not cause any long-term ill effects. You may have some bone pain from the Neupogen, but that disappears over a day or two. And as I said, long-term, people do very well.
As Dr. Minden mentioned, most stem cells that we collect are through peripheral blood and not through bone marrow. And so as Dr. Minden mentioned, there's 2 methods of collecting stem cells from healthy donors. So we can either collect it through peripheral blood or through the bone marrow. The majority of stem cells that we collect are through peripheral blood, and so about 80%. And it's an extremely safe procedure with no long-term ill effects. And what it involves, as you mentioned, is several days of an injection to move the white cells into the peripheral blood, so then we can collect it on a machine. The time commitment is minimal, and you're left with knowing that you've helped someone out around the world and that you've helped save a life. With regards to long-term effects, I know there are some concerns out there about worry about pain from the procedure. It's a very well-tolerated procedure in most people, and I know there's some worries out there about not being able to walk after the procedure. That would be a very rare event.
So you explained the recovery process for the donor. Can you also talk about what the recovery process will be like for Noor?
He would be in hospital for about a month after the transplant, and then he's seen frequently for the first 6 months to a year, because there's a chance that the donor cells can recognize him as foreign, and they attack his cells, causing something that's called graft versus host disease. And that's a condition where either the skin is affected, or the liver, or the lungs, or the gut, and so people have like a skin rash or a sunburn. They may have severe diarrhea because of the graft versus host disease, and they have to be followed closely for that. Over time, GVH settles down, but in the first 6 months to a year, it's more of a problem, and close follow-up is needed.
So Jasnoor has also just recently relapsed. How important is a bone marrow transplant for him at this point?
The transplant has a chance of getting rid of this forever.
Yeah.
Whereas there's still a significant chance that he's coming back with the chemotherapy and the dasatinib. However, so you're looking at the potential of, with a transplant, a cure rate in the range of 50% versus maybe 10-20% just with chemotherapy and drugs.